So, good morning to the participants of the DPHI Con 2025. I'm happy to be here. I think some issue is there from my side. I'm not able to put on my camera. So, of course, meetings like this, public health meetings like this are very important for knowledge sharing, collaborations, networking, and of course the deliberations which take place here. They're important for policy making and advocacy impact, and of course professional development of the public health professionals working all over. And it is important that the cross learnings which we take from here, they're important in improvising our future actions, and how we can um, embark upon the future policies or the activities which we need to take, sort of a course correction or something like that. And yes, as public health professionals, we have an uh, important responsibility in front of us, in a way that it is our responsibility to see that the population, the human resource is utilized to the maximum. They don't land up into hospitals, and they're able to economically contribute to their family, to the community, and the society as a whole. So we need to embrace the and strengthen the health promotion prevention aspects of the thing. And of course, as far as the public health system in Tamil Nadu is concerned, there is a strong primary healthcare network foundation is there, and a lot of things are there which the other states they can take lessons from here. Apart from the robust maternal and child health services, the free drug initiatives, the whole lot of innovations, we often take lessons from here in the NHM component, and try to seek replicable models for the other this thing. So it is nice that DPH is doing a great job, and we are here to discuss on tobacco control today. Uh, Before start discussing, let us try to understand as to why this particular topic was chosen and why this is having uh, in a way, I would say, control the communicable diseases, and now the disease transition is towards the non-communicable diseases, NCDs. Tobacco is one of the important risk factors, and substance abuse, it has become a major public health concern all across. Uh, so all the more it becomes very important that we discuss upon the issue. What is the burden? What are the activities which we are currently doing, and how we need to work towards combating this menace. Uh, Tobacco substance abuse, it affects the younger generation, so that is the future. So that is very important. It is one of the key risk factors. So primarily tobacco, alcohol, unhealthy diet, lack of physical activities. These are the four major risk factors for NCDs, and tobacco is one of the key risk factors. And apart from this, it does have an economic burden as well. So Tamil Nadu has been doing a great job in tobacco control since the program inception of the program, and of course before that as well, since 2007 and 8, when it was started initially in first two districts. So let us try to understand what are the great things which we have seen here, and what we need to take across the learnings from. So next slide, please. Yeah. Actually, there is some issue with my video. I'm trying to put it on. So I think if I log out and then log in, I will be able to do it. So I don't want to do all that. Let us continue with this. So if we see the burden in the state of Tamil Nadu, we have the number of tobacco users, in a way, urban, rural, and the total. So 20.1% in the males, and females it is around 5%. So this is state specific data. And yeah, so next. This is the program structure, wherein there is a state tobacco control cell. Of course, it is there in every state. And here at the center, we have the National Tobacco Control Program. And from the state tobacco cell, it oversees the activities of the district tobacco control units. So we have district tobacco control units in almost all the districts of the state. And this is a great thing. It is one of the few states wherein we have these in all the districts, and they have been doing a great job. Of course, the different components which are seen by the district tobacco control units are regarding the monitoring of the tobacco control laws, and of course reporting on our MIS portal, the training and capacity building. It includes healthcare, apart from the healthcare workers, of course, that goes on in other programs as well. It also includes training of the law enforcers who have to enforce our legislations. Then we have this IEC awareness. We have villages, schools. So all of that, it has to be popularized. Basically, in tobacco control, we have two groups of users. Two sets of people whom we try to address: users and non-users. So the users are basically those who have already been using the product. So more of a cessation, or we need to advocate with respect to why is it harmful, and how they can seek our cessation services. But for those who are non-users, that is particularly the youth, so we target them so as so they do not become future users. And for the information of the audience who are maybe they are not who are not the part of tobacco control, tobacco kills half of its users. So industry is always trying to find new users. So they have very innovative strategies, in a way how they will be attracting. They attract the new users, and how they this thing. So all of that goes in part of the IEC and school programs as well. So these are very important. And then of course the tobacco cessation for the tobacco users. So these are the activities which are undertaken by the district tobacco control units. Next, please. At the state tobacco control cell, so we have a legal team, and then the other supportive staff is there, apart from the state nodal officer and the senior medical officer supporting the team. So we have the state nodal officer, Dr. K. Krishna Raj, currently looked after NCT as well. And there are a lot of we've been motivated by the kind of initiatives and innovations we get from sir. And yeah, next please. So this is phase wise strengthening of the tobacco control activities across. It started off initially, the program was piloted in 100 districts, and after that two districts were there in Tamil Nadu, 2008, and after that in a phase-wise manner across the different districts, the district tobacco control cells, they have been established and strengthened, and today it is all across the state. Next, please. So let us discuss upon the few achievements and how they are crucial and important, and how they seek to address the issue of tobacco control. Next. So yeah. So first is ban on electronic cigarettes. So just for the information of the audience, electronic cigarettes are something which are banned in India in 2019. But this ban, it was initially Tamil Nadu was one of the few states who initiated this, and in fact in 2018 itself, 1 year before the Central Act came into this thing, it was banned. Now, what is electronic cigarette? They are trying to deliver nicotine directly. So in tobacco, there are around 7,000 harmful chemicals. Out of this, one of them is nicotine, and it is nicotine is one of them is nicotine. So the e-cigarettes, they are trying to deliver nicotine directly to the user. So this is and of course nicotine is the product which is addictive. So that is why this is harmful. So it was banned here. This is one of the pioneer steps. Next, please. Second is the ban of hookah bar. So the we have this central law, Cigarettes and Other Tobacco Products Act, code for 2003, and Tamil Nadu is one of the few states who have banned this uh, hookah bars in the state by the way of amendment in the act. So Tamil Nadu Act 22 of 2023. So this is also a welcome state, and of course we always try to cite the example to the other states as well, that hookah bars, because in hookah bars also liquid form of nicotine. So similar way of e-cigarettes. So this is being given, and then it is also in a way um, what to the other drugs. So the youth who are trying to use it, they also go on using it. They are also hooked to the other drugs. In a way, tobacco is an entry product for the other this thing. Next, please. Ban on smokeless tobacco. So this is something which is also innovative. Gutka and pan masala ban containing tobacco and nicotine. So this is banned here since 2013, and annual this thing notifications are also, the latest renewal is effective from 23rd May 2025. So two types of products are there in tobacco: smokeless tobacco and smoking products. So smokeless tobacco ban is a very commendable achievement. And India, out of 27 crore users which are there in the country, 20 crores are the smokeless, which we call by the name of gutka, khania, and all those products. So this is something which is there, which is completely banned. So this addresses, this ban in a way addresses the most of our problems, and of course I would say that lightens this thing. So lightens our burden in terms of enforcement as well. So this is one of welcome steps, and I think we would encourage that the state continues with this. Next, please. Some of the key state laws and rules in Tamil Nadu: the Tamil Nadu Prohibition of Smoking and Spitting Act 2022. So this was also very effective, which prohibited smoking in places of public work or use. Then cigarettes and other tobacco. This was of course enforced enforced completely in the state. So this particular law, it has uh, broadly important five sections. Section 4, which is ban in smoking places, public places. This is very important, and it has been very effectively, actually it has been very effectively implemented. So this is something which is it is very heartening to note. Then of course the other sections wherein the schools, so educational institutions around 100 yards, availability of tobacco products within the 100 yards of the education. So this also has been very stringently enforced, and we have it is I would like to acknowledge and congratulate the tobacco control team there in TN, that we have enforcement squads in most of the states. So this is most of the state. So this is also one of the, and of course the civil society organizations are also effectively coordinating with the state and the district team. So this is something which is very this thing notable. Then we have the direct and indirect advertisement of tobacco products. So this, and of course health warnings, of course they are being effectively implemented for all the local products which are being manufactured. Next, please. So these are some of the achievements over the years. Lot of fine which have been covered under the sections. I would not specifically take the name, the amount, and all of that. Next, please. Next. Yeah, so the total trainings and how much of capacity building has been done in terms of schools which have been declared tobacco free. So 50,000 schools have been declared tobacco free. Colleges, so around 2,200 plus colleges have been declared tobacco free. So this is a great achievement, of course. And continuously tobacco the state has been doing a lot more to increase the number of people who have achieved tobacco cessation and beneficiaries. It is said that quitting tobacco is difficult. Only 3% of the tobacco users are able to quit, and of course, it requires a lot of pursuance on the part of the counselors, and of course, um, in advanced stages a sort of pharmacotherapy and all of that is also required. So this is a difficult activity, but that also has been effectively these things. And IEC campaigns, so anti-tobacco day celebrations, mass media campaigns, human chain signature campaigns, and all of these has been regularly done. And taking a cue from the state, we also have nationally now currently the third year running the youth campaign. So how specifically targeting the youth, we are having a tobacco free youth campaign nationwide. So this is something which is very notable. Next, please. So these are some of the key challenges. Of course, every public health program has certain challenges. So these are a routine lack of awareness, because when the number of people who from the children, then they become to the youth and they become adults, so that lack of awareness. So awareness, of course, it is an ongoing activity in a public health program, so that of course has been done. Enforcement challenges, because transfers of the teams are happening and all of that, so that also needs to be strengthened. All of these are routine ongoing challenges which are and of course, nicotine, actually e-cigarettes, that is this product, it is a challenge across the country. Actually, e-cigarettes which deliver nicotine directly, so that is something which is a point of concern. And I think the PECA Act, Central PECA Act, it has been, of course, been enforced effectively, and that good work, I think, that needs to be continued. And just one more point, which I before I wind up, that Tamil Nadu is one of the leading states for the I think couple of years last I think since the inception, as far as I am aware, they have been winning the tobacco free youth campaign award nationally, and one of the best performing states. So this is also something which is very inspiring for us and enthusiasm. And the team, they are trying to get their act together to address this important public health issue. So that is all from my side. Thank you.